Hi, I'm Dr. Leila, a California board-certified family and cosmetic dentist and the proud owner of Leila Hariri Clinic in Dubai. I graduated from UCSF, one of the top 5 dental schools in the world, and bring over 25 years of experience, 21 of them right here in Dubai. I've been honored with the I Love My Dentist award twice, thanks to the trust and connection I share with my patients. My mission is to transform smiles, build lasting relationships, and make dental care something you can feel confident about. Join me as I share expert advice, stories, and insights to help you achieve the healthy, beautiful smile you deserve. Today, I'm thrilled to welcome an exceptional guest, Dr. Kelvin. Dr. Kelvin is a Canadian board-certified specialist in prosthodontics and aesthetic dentistry with a PhD in dentistry equalized by MOE and a fellow of the Royal College of Dentists of Canada. His work is renowned globally. Dr. Kelvin also serves as a visiting scientist at one of the top dental schools in Switzerland. Thank you for joining us, Dr. Kelvin. It's an honor to have you here.
Thank you, Dr. Leila. I'm so happy to be here.
The pleasure is ours. So let's start with something that is central to both of our practices. That's patient satisfaction and how it ties into the quality of life. How do you ensure that not only are you giving great dental work, but you're increasing their quality of life?
Yes, in this case, I've learned over the years and also through research that we need to take care of our patients, what they feel, what they need, what they desire. So we need to listen. So I became more of a listener as time goes by. So I involve the patients on their treatment plan as well. So I always try to offer a variety of options that are going to serve them. With that, I can provide long-lasting results that are going to be looking great, and also they're going to be there for a long time and they're going to function excellent.
Listening is a great advice for everyone. And I think in all relationships, not only a doctor-patient relationship. I agree with you. And how do you balance aesthetic and functional outcomes to meet your patient expectations?
Yeah, well, each patient is totally different from one another. So we need to look at their gender, we need to look at their habits. Is also there's some kind of parafunction. We need to look at the bite, how it comes together. We need to also to look at the jaw, if there's any kind of pain or some other kind of symptoms. Also, we try to plan everything before we start. So we need to be very good at record taking so we can have a proper plan. And with
Correct.
that, we can start with an informed decision so patients can be super happy, not only after we deliver, but also with the time when they come back to us for maintenance, they can still give us excellent feedback.
Planning is key, and I can attest to that because through the journey of learning, I can definitely say that there was a case where I didn't plan it from A to Z, and that was the one case that I felt it was a failure. So planning is a must. So thank you for sharing that. And you're an expert in veneers and implants, particularly in the aesthetic zone. Could you share your insights on how to achieve natural, long-lasting results in that area?
Yes, Dr. Alila. Well, anything that we do in the aesthetic zone or the area that is the visible part of the mouth when patients are smiling, when they're laughing, when they're interacting with the public, right, is extremely challenging, but also rewarding. So we need to see, right, how is the lip dynamics, also how is the teeth proportion, and how it looks with the gums. And then we look at the smile, also how it interacts with the face, right? Anatomy is also a big part of what we do. And also, if there is anything missing, we try to reestablish whether it's bone grafts or tissue graft. We try to have predictable results, so there's no upsets, and we want to keep high the satisfaction.
Thank you for that. And there's many ceramics now in the market. How do you decide which one is appropriate for your patient?
Yeah, well, again, we'll see the area of the mouth that we are working with, because again, we have too many options out there. Basically, in areas that are more, important for appearance or that we need more beauty, we would go with something that's going to be more translucent. So in my practice for veneers, I would prefer probably lithium disilicate if I cannot do feldspathic porcelain, which is the most beautiful. But sometimes we don't have probably a master ceramist that is close to us. And also we might need something that is going to be more resistant, right? So that's when I go for that material. In other areas that are probably not showing more, which probably the back of the teeth, I would go for a harder material. So this could be zirconia.
Beautiful. And full mouth rehabilitation, as we all know, could have its complexities. How do you go through your mind as to plan it out, basically.
Yeah. So once again, we have to look at the overall in the patient. First of all, listen what they want, what they need. Looking at their bite, at their jaw, how it goes, how it fits. Also, what are the habits? What's the diet? And what they need, because sometimes it's about replacing some tooth structure that might be missing, sometimes teeth that might be missing, and we need to be like little detectives. We need to know for how long it's been missing and how we can serve our patients, and also if they already had prior treatment, what was it, what did they like or what didn't like about it. So we don't want to repeat something that has not been great for our patients.
Correct. So analyzing what is the core of the problem, why they're there, with the problem in our chair. Absolutely. You're so correct. We are little detectives. And we've both been in this field for decades. How have you personally, as a clinician, adapted and grown?
Yeah, well, as I said, no, I've been evolving, right, in the how I deal with my patients, right? Like it's always been important to listen to our patients, to have a good connection with them, get to know them, so we can serve them better, right? And also from the other, technical aspect, we are going over the decades, right, more and more digital, right? When we were just probably flirting a little bit with the idea of digital, now most of our workflows are digital.
They're digital, correct. And if we don't pick it up, we'll be out of our industry. I think, AI is definitely coming. It's already been in dentistry, actually, and we have to roll with it or else we'll be behind. How do you deal with ethics and cosmetic dentistry?
Oh, thanks for asking about that. It's extremely important, right? Everyone nowadays is so interested in looking great, right? But we need to do it with ethics in terms of not every patient might need to have, for example, veneers, right? Or maybe a ideal candidate for Hollywood smile. So in that case, we need to tell them of the importance of preserving their enamel, right? And there's some other cases, and we don't need to really remove much enamel. So it will be prepless or minimal preparation for getting those veneers. When we say preparation, it means cutting a little bit the teeth.
Exactly. And you don't know how many people I've turned away from veneers. And I know if it's in their mind, they'll probably go down the street and do it. But I said, I am not going to do it. If I don't see the end result, I'm not in for it. You said prepless. What is your take on prepless veneers? Because I've always debated on that one, completely prepless.
Yeah, well, before we used to take, an impression, conventional impression, we send it to the lab or we do it ourselves, and we start looking at the areas where probably there's undercut, right? Nowadays, we can take an intraoral scanner, which we can analyze in a software. We can see the undercuts, and in that same appointment, we can look at those areas where we might need to refine, right? So we are touching very little of it. So to have, an ideal case for prepless is very rare, but there might be
Thank you.
some of them. Yeah.
Thank you for that. And this is just a side note. For me, I always think if I don't put this tiniest margin where I always explain, it's like the home where the house, the veneer comes and sits on. I feel like 10, 20 years down the road, when I look at the gums, they won't be as amazing. I know they try to make it as thin as possible, but what's your take on that?
Yeah, well, I am with you, right? So there's tendencies, right? Or there's trends that they come and go, right? So lately the BOPT, right, is being done there, right, where you don't need to really have a very clear margin. It's kind of a
Correct.
feather edge where
Or I call it
traditional.
vertical. Now I'm doing a lot more vertical.
Oh, nice, nice.
Yes.
Yeah.
Yeah.
So traditionally, we were totally against it
Yeah.
because we were afraid of over contouring, right? We will have that emergent profile that is going to be beautiful, that is going to avoid to have, plaque accumulation and probably end up with swollen gums, right? With the gingivitis. That's something that we don't want to have there, right?
Correct. No. I'm transforming more into vertical preparation, even for posterior teeth, because I feel that transition is so much better than even the chamfer. But this came with time as well, like everything. So prevention is something we always stress in dentistry, yet follow-ups often get overlooked. How do you communicate the importance of these to ensure long-term success for treatments like veneers and implants?
Very good. So it's very important now when we have to do the maintenance, right? Most of our patients and even sometimes our colleagues might think like You just deliver the case and that's it, right? It's almost like a divorce from the patient. But in contrary, we need to continue and we need to motivate them to come to their appointments. But how is going to be that, right? So it has to be basically like we need to encourage them to preserve their investment, what they have worked so hard for, right? Because these treatments, sometimes they can be very quick, sometimes they take a lot of time.
Correct.
They take a lot of time also from us. They take a lot of time in the
Yes.
chair.
And it's not easy. It's not easy on a
I don't
patient.
know if it's super fun for them
No.
coming to the dentist. I don't think so. But if they want to come to the dentist less, interestingly, they still need to come to see us like every 3
Correction.
months, every 6 months,
Prevention
every
is
year.
key.
Exactly.
Yeah,
They say
yeah.
it's better to have, 100 grams of prevention than 1 kilo of treatment.
100%. And I think having a good team is fundamental. Having a hygienist that knows the ins and outs, to get them back, they're interested to come in. I think that's the best, I see them coming through and then I pop in for the exam and I'm like, yep, everything's perfect. And I'm happy to say it's perfect. Mouth guards are a great tool. What is your take on that, especially after full mouth treatments?
That's beautiful because this is right there touching into prevention, right? So once we have delivered the full mouth rehab, right, we need to have some kind of guarantee or to safeguard. So for me, like this is part of the treatment when we go for full mouth rehabilitation. It's not even something that we will discuss. It's right there from the beginning. Patient knows that at the end of the treatment, they will be using a mouth guard for life every night. And it's not only for patients that they have the full mouth rehab. Also, we have some other, patients that they are grinding, right? Or they are clenching. And this could happen during the night or during some periods of stress. So
Correct.
mouth guard is really important. Unfortunately, it's being underutilized.
Correct. And now I say if you're wearing a night guard and it's working, a lot of people actually need day guards too, but we can make them really thin so they can go through like the Invisalign, retainers. But absolutely, I'm a true night guard wearer and I can't sleep without my night guard now. It's like my pacifier. So I'm with you on that. This has been incredibly valuable for our listeners, for other dentists, I would say. Thank you for this, by the way. And is there one last thing that you'd like to just reach out to our audience and let them know?
Yeah, for sure. For example, for our colleagues, they need to remember about the power of education, right? Of lifelong journey that we have because we're in the area of healthcare. So it doesn't stop like you graduate, right? Or you did a specialty or certificate, and that's it. We need to continue with our study, right? That's something that never stops, I guess. And in terms of the patients, it's important to always they try to inform themselves a bit more, ask us. We're happy to give them answers so we can really involve them in the treatment so they can have those informed decisions.
So listen to our patients.
That's correct. We need to listen to them, right?
Thank you so much, Dr. Kelvin, for this episode.
Thank you, Leila. Thank you for having me here.
And to our listeners, if you enjoyed this, please subscribe and follow us more for amazing dentists. And soon I'll be bringing some of my patients that are not in the dental field, but I think we'll gain a lot of knowledge from them as well. Thanks again.